Hello, my name is Dillon Trelegan. Today we'll be looking at a case study of a hand laceration with damage to the ulnar nerve. So, quick introduction to the patient. It was a 22-year-old D1 men's hockey player. Suffered a laceration to the palmar aspect of his hand. This laceration happened to damage the palmar digital branches of the ulnar nerve. The athlete received stitches along the laceration and was immobilized for 2 weeks. So, post removal of the stitches upon evaluation, the athlete had decreased wrist range of motion and strength, as well as decreased finger range of motion and strength. The athlete also had decreased sensation on the fourth and fifth phalanges down to the medial aspect of his hand. So, some of the short term goals were to decrease pain, prevent infection on the scar, reduce the scarring, and increase range of motion. Some of the long-term goals were to restore strength to the wrist and hand, equal bilaterally, restore sensation along the medial aspect of the hand, and have the athlete return to sport with full function. So, treatment for the athlete received treatment Monday through Saturday during his practice times. After removal of the stitches, the week one rehab consisted of range of motion exercises for the wrist and finger, as well as some light massage around the areas of the scar that had been healed. The range of motion exercises consisted of touching the thumb to each finger, tendon finger glides, which you can see a picture of on the left, as well as some wrist extension, flexion, ulnar deviation, radial deviation, and we also used the prayer and reverse prayer stretch to help gain some range of motion. So in week two, continued with those same range of motion exercises, as well as a cross friction massage to help promote scar healing. In week two, we also started to do some strengthening exercises using a 4 pound weight going through those same ranges of motion. And we also used a finger web to help strengthen the fingers. And then in week three, the weight used while going through range of motion was increased, as well as the tension of the finger web. And we also had the athlete start using some putty to help increase his hand strength. Towards the end of week three, we were able to get the athlete in his goalie glove and start having him catch a puck that was thrown. Felt that shooting might be a little too hard, so just catching a puck thrown by another person would seem to be at a better pace for the athlete. And then, in conclusion, the athlete was able to return to practice 5 weeks after the injury. Return was determined by strength compared bilaterally and his pain level. He was slowly progressed into shooting drills as we monitored, looking for pain tolerance and sort of that wrist strength while catching a shot. And then his wrist was also taped to help add support upon return.